There's so much emphasis put on increasing the number of solutions for addressing health issues. And yet those solutions are not reaching every community. What we see is clinical health workers spread incredibly thin. So what VillageReach does is we focus on what does a health worker need to make sure that they can deliver quality healthcare to the most rural and underserved communities. That's something VillageReach cares about deeply. If you think about all of the different things that need to happen to have a quality healthcare system, it's a jigsaw puzzle, and there are a number of different pieces. And VillageReach is very realistic that we're only able to address certain pieces of that puzzle. But over time, what we hope is that as we address each piece, you start to see that complete picture. And I think one of the most promising innovations that we've come up with is really quite simple. It's putting clear responsibilities in the hands of a small group of people to be responsible for ensuring that medicines get out to everybody and then providing them with the infrastructure that they need, communications networks, power, transport, in order to support their work. Just doing this with vaccines, women know that they need to bring their children for vaccines, but if they walk 3 hours to the health facility and those vaccines aren't there, they're not going to come back. And so if we can fix just that availability piece, we've actually found that it has transformative impact on women and children. So in the environments where VillageReach works, I think you'll see three things. I think you'll see better organized facilities where clinical health workers are doing the frontline clinical work. I think the other thing that you would see is a more engaged community. So one of the things that we've started working on is how do we improve communication between the community and the health center. So doing things like free phone hotlines where community members can call in and determine whether or not they need to actually walk 3 miles to get to a health facility. And then I think the third thing you'd see is more engaged governments. So governments that are excited to be seen as trailblazers. We see in Mozambique, especially with the vaccine team, that they're now highlighted globally for their work and their leadership in this area. And they're proud of that. In Malawi, we see the teams from the reproductive and maternal health units also being recognized for their leadership and their innovation. So over the next 5 years, what I hope is that we will have created enough of a groundswell of support to see that medical supply chains are being addressed around the globe. The world that VillageReach wants to see is a world where all communities, no matter where they're located, have access to quality healthcare in a sustainable and scalable way. And I think all of us as social entrepreneurs need to be honest that this is a long, hard road. But if you can stay focused, that you really can see transformative change.